This survey that landed in my inbox this morning. It's a survey sent to spinal surgeons asking them about the advice they give to patients after microdiscectomy surgery. There's some pretty stock standard preliminary questions, but I'm going to spend a bit of time just talking about the most relevant questions that highlight an important point. So question 9, what has the most influence on the level of post-operative activity you recommend? And my answer to that one is not even on this list, and it's how well does my patient understand movement proficiency perioperatively, because the patient's got a lumbar disc prolapse, which is symptomatic and causing compression of his lumbar nerve root, which causes severe sciatic neuropathic pain, and therefore they're taking the step of having spinal surgery. The most important thing for me is, does that patient understand why they got their disc prolapse in the first place? And the answer to that is because of movement dysfunction. That caused the biomechanical stress, which caused the accumulative biological inflammation, structural breakdown, and then ultimately the disc prolapse, which is now having to have a surgical decompression. So that's the most important factor for me here, and it's not even listed as an option. So of course I've entered that into the other section. Number 10, in your opinion, what are the greatest risks for complications secondary to the discectomy? And again, it's not even on the list. The size of the annular defect is important, but that's a structural element. But more importantly is, again, does the patient move proficiently after their discectomy surgery? Okay. How important are sporting activities? How important are sporting activities after discectomy? It's very important, because if you engage in sporting activities with proficiency, and that's the most important caveat there, is if you engage in those sporting activities with proficiency, that's what drives health back into the disc. Okay, remembering that a microdiscectomy operation does not make the disc healthier. It's purely to decompress the nerve. You've still got to complete the circle of care and drive health back into the disc by moving well and allowing natural healing to occur. If you don't move well, then natural healing will be stunted, and you'll probably end up with a chronically inflamed, painful disc, which then causes back pain and then puts you at risk of having a re-herniation down the track. Do you think sporting activities have an important impact on the recurrence rate? Well, it's not so much the sporting activity or the activity itself, it's how you do the activity. Whether you're lifting a heavy barbell, doing a deadlift, a clean and jerk, or whether you're simply brushing your teeth or emptying the dishwasher, putting on your socks. If you perform the physical activity poorly, even trivial tasks can cause significant complications and re-herniations that cause recurrent pain and disability again. So it's just not, you can see that the industry is just not thinking about movement proficiency or movement dysfunction as the disorder. It's just like completely sort of being ignored as the most important factor. And as I've said, we need to collaborate and get this out there so that the industry can bring about a major paradigm shift in the way we look after spine. And here we go. It's just this time frame is irrelevant. Of course, it does take time to heal, and particularly the lumbar disc, which is quite an avascular structure. It can take 6 to 12 months for those tissues to really consolidate their scar tissue. But it's not just about the time frame here. It's about how well, what are the biomechanics being expressed during that time frame. Because if you've got poor biomechanics during this time frame, then even 6 to 12 to 24 months after surgery, the disc will not have healed. Whereas if you have good biomechanics and you're fairly young, you can really drive health back into the disc in very short time periods. Okay. Again, it's just all about time, quantitative measures, not qualitative, and then talking about, what sports? Like, does it matter what sport? It's about how you engage in that sport, am I maintaining my hip-centric rotation, neutral spine maintenance? Am I driving my movement with my posterior kinetic chain? Okay, it doesn't really matter what sport you're doing, as long as you're performing the sport with biomechanical proficiency. So again, these survey questions just highlight a really important fact to me, that we need to understand the root cause of poor spine health much more broadly than just asking these quantitative questions. It's really about quality, and when we're talking about functional movement, we are talking about or therapy, functional movement therapy, we're talking about skill acquisition, and that's one of the characteristics of a functional intervention. Just waiting for time to pass and rebuilding a core strength or a flexibility or fitness is not the answer. Fitness and capacity comes later. First, you need to lay that foundation stone of movement proficiency. All right, thanks for listening. Bye now.